Good afternoon, everyone. My name is Linda Wardell. I'm the General Manager of City Creek Center and the Board Chair for the Salt Lake Chamber. It's my pleasure to be your host this afternoon as we talk about creating a safe and healthy work environment and returning to work, which is something that I am very excited about the possibility of doing, and I'm sure most of the rest of you are excited about too. Thank you all for joining us for this important discussion. This series will address the steps and considerations necessary to get businesses back to work in our new normal. Business, industry, and health and safety experts will share how to implement the Utah Leads Together plan in local businesses and organizations so that we can safely return to the workplace as Utah gets back to work. We'll be kicking off our new session with creating a safe and healthy work environment plan as we do return to what is our new normal, and we'll start to understand exactly what that is today. We'll learn from health and safety experts as they share tips, tools, and models for businesses to incorporate in their business to quickly get back to work and reopen in a safe and healthy way. And I know safety is on the top of all of our minds. We'll learn key questions that each business should ask, as well as learn tools and resources that are necessary to get your team back to our new normal during the stabilization phase, which I hear we may soon enter, as we implement the Utah Leads Together plan. Through this session, participants will learn key aspects of putting their own return to work model together for their industry and their businesses. And I know we're all busy working on our reopening plans right now. We will hear first an overview of the current situation and the open up plans from a panel. Joining us today is Dr. Kurt Hegmann, who's the director of the University of Utah Rocky Mountain Center for Occupational and Environmental Health. And we'll hear from Dr. Matthew Thiese, who's the associate professor of the University of Utah, and from Katherine Clark, who is the senior vice president and CRO at Workers' Compensation Fund Insurance. So panel, please take it away.
All right, welcome. My name is Kurt Hegmann again, and we're so glad that you could join us. We're going to do initially is talk about a few of the background important points that we're keeping track of, and then projecting forward because past lessons need to be retained going forward. Next slide, please. Obviously, we know this is a coronavirus originating in Wuhan. Whether it's an accidental incident versus a lab accident ultimately needs to be determined for prevention purposes so that in the future we don't have another pandemic and/or we have in place processes to preempt a major pandemic or at least slow it in the future. We also know about the situation with travel being important in terms of the shutdown process where travel was ceased gradually. And that now has implications, of course, for the resumption of business as normal. When we project forward to the US situation, our first outbreaks were in Seattle and Palo Alto, the Bay Area of California. And we all recall that we have had a lot of problems with the testing capacity. That has been mostly addressed in Utah. There are parts of the country where that's not true. So a business that actually has businesses in other states may still encounter considerable problems with the testing capacity. We've been very fortunate in Utah on that one. Going forward, antibody testing, of course, will be the area of focus to see if we can't better identify the individuals who were affected and then are hopefully at least somewhat protected. It's also important to note that in New York, which was not the first focus of the infection here in the United States, our sequence of events regarding the first community spread case occurred earlier than the closure of the schools, which was March 18, and then subsequently the businesses were closed and the stay-at-home order was given. Now, as you recall, New York, of course, has had a huge problem. In Utah, we had a little different sequence of events, which I think is illustrative of both past as well as prologue. Schools were closed on March 13, then our first community spread case was identified after, and then businesses closed on the 17th. What we need to remember is we think that because the students or the children have such mild cases, parents wouldn't know. They would send the children to school, the virus gets passed around, then it pops up into the adults as an epidemic wave. That has implications for the fall in September and October, of course, with resumption of schools. So that's why the focus in on that time frame. One of the rules of an epidemic is a day is an eternity. And this is something which small business owners are going to actually be better prepared to understand than the large ones. A small business owner is typically encountering various problems that they need to solve on the fly every day, whether it is a delayed delivery or a production problem and so forth. In a large organization, that's typically not handled in the C-suite. And so a small business owner can better, I think, understand the issue of taking your best shot at it, making a decision. When the facts change, you take another swing at it and moving on. That's the rule of epidemics. It's not too difficult, again, for small businesses, but the larger ones are a little bit more challenged, actually. Dr. Thiese.
Thank you very much, Dr. Hegmann. So again, my name is Matt Thiese. I'm an occupational epidemiologist up at the Rocky Mountain Center for Occupational and Environmental Health. There's my contact information. Anyone is welcome to reach out to me any point in the future. If you have any questions that I may be able to answer, I will do my best. So I get to talk about some data in terms of how Utah is doing. So I put this information last night from the COVID-19 dashboard from Johns Hopkins University. Total confirmed 3,297 individuals. We only had 32 deaths. So when you compare that with what's going on with states who have a similar number of confirmation, we're actually doing really well. You'll also notice up here, 72,000 individuals have been tested, and tests are still ongoing throughout the state. Here in the bottom right-hand corner is an epidemic curve for the state of Utah. So you can see how things are still increasing, but hopefully they're not as steep as they could be if we hadn't taken, if our governor and others had not taken actions when they did. And things are progressing reasonably well here. So one of the things that I would like to talk about is a crush the curve solution. So this is really a potential solution, and several things working in tandem here to be able to try and move forward. It's a public-private team working with the state of Utah, local officials, as well as private industry. And really it's an overview with a survey assessment to assess individuals, both underinsured, uninsured individuals, as well as people who have health insurance. And then also have periodic follow-up to identify those people who are potentially having problems with the disease, and then be able to connect them with either telehealth or some other type of treatment or diagnosis and then treatment. We have population-based data, and being able to provide information to the decision makers to move things forward and move forward with our metered reopen that's been referred to as a dial, not as a switch. So it's not just an on or off moving things forward. It's being cognizant of the data and making decisions that way. So here, really the solution is with flattening the curve is identifying individuals based on their symptomology and being able to refer them or move them forward in terms of diagnosis, testing, diagnosis, and treatment, so that they don't increase and go on a poor trajectory and need more severe care, respirator or ventilators and that type of stuff. So public-private partners, there's a bunch of them here working on this solution. Right now, the focus is on testing and contact tracing, and being able to identify things there. So briefly, I also want to talk about Utah's reopening and the decision-making process there. I know that there's a lot of questions in business about how this is going. So the decision maker is Governor Herbert, and he has several advisory structures. Some are both, so the Utah Coronavirus Economic Response Task Force, as well as the Public Health and Economic Emergency Commission, are directly advising him. And then there's other advisory sources, including other elements of the executive branch, the Utah Department of Health, legislative branch. And then he's also working in tandem with local governmental issues. So this isn't a uniform statewide dial. They're cognizant of different needs within the communities of how to move forward. So right now we're categorized in a high risk situation. Ideally, we will move relatively shortly, we will move to the moderate risk and be able to open some things up. So in terms of the short term, our red risk category, there is going to, in some level, some resumption of some business operations, and with the caveat to continue to use extreme caution to protect both workers and customers. So extreme caution is everything from appropriate hand hygiene, wearing masks, identifying, working with customers or working with employees to, if people are having symptoms, to try and be able to isolate them and get them assistance as needed. And then also having ongoing surveillance. This is an issue that I'll bring up a little bit later, but there's a possibility of a second wave, a likely possibility of a second wave of infection at some point as the state relaxes and individuals relax their self-isolation. We go out and start communicating more with others and potentially spreading the disease. And so it gets back to that dial approach of having tightening things down and then slowly releasing the dial instead of flipping a switch and going back to normal. So by having this ongoing surveillance, you can monitor and make appropriate decisions as to how quickly or slowly to open up things and resume business as normal or the new normal. So again, this metered approach really does depend on some surveillance, and with ideally avoiding resumption of limitations if possible. In terms of the longer term elements, it's resuming schools and other businesses, and then having some anticipation of that epidemic echo or that second wave, and trying to identify it when it happens and address things as that wave occurs in the early stages to make sure and ensure that the size of the second wave and the impact is minimal. There is continued avoidance of exposure of susceptible individuals. So again, older grandparents or immunocompromised individuals or those with comorbid conditions, continuing to self-isolate or minimize contact with others. And then again, continued surveillance as we move forward. So this is an example graphically of that second wave that we talked about. Unfortunately, the best data that we have is 101 years old from the influenza epidemic of 1918 and 1919. So the main peak was there October, November into December, and then you can see the second wave, which occurred as guidance and people were released back out to start going back to work and things in February and March, and tailed off into April of 1919. So in terms of reopening business priorities, obviously opening businesses where wide spacing is readily available would be something that makes a lot of sense. Again, trying to maintain that distance and the 6-foot distance and preserve sharing of space and therefore sharing of the disease if people have it. And then once that's figured out and people those businesses are open, then we can start opening intermediate businesses where some distancing is possible, and then opening the remaining businesses from there. So there is some understanding of priority to prioritize essential businesses that have been closed. And as part of that, providing surveillance and training for those employees, providing, making sure that people understand what the symptoms are, how to appropriate hand hygiene, appropriate mask wearing, social distancing both while at work, and continuing to protect workers and workers and customers as best we can as these businesses open up. So it's not a one-size-fits-all situation. It is definitely industry specific as well as location specific. So thinking about how in your business or in your industry, these types of practices of distancing, wearing masks, maybe sharing shifts or that type of stuff, disinfecting, all of those elements can play a role in this. So I would like to turn the time now over to Katherine Clark.
Thank you, Matt. I appreciate your patience with me as I get the screen shared. I am Katherine Clark. I work as the Senior Vice President of Safety and Health and Chief Risk Officer for WCF Insurance. We are returning to the new normal, it sounds like. I know people are anxious to get back to work. Businesses are anxious to get back to prosperity. It's important that we do it safely. So I wanted to share what we at WCF are in the process of doing. We have been planning over the last couple of months, as well as planning to shut down or reduce operations. We didn't shut down because we're considered an essential business. But the way we have actually proceeded through this pandemic, and also how we plan to bring people back. Right now at WCF, we have what's called the Stay Safe, Stay Home. We have pretty much most of our population is working remotely. We have a few essential employees that we have had to protect as they go into the building every day, and they have had to be forward facing with the public. This is just a picture of me with my granddaughter. I happen to be among those that have, my husband has a heart condition that he has had over the last 16 years. And he is really, one of those that are vulnerable. And so we have to distance ourselves even from our grandchildren. And that's been pretty difficult. So those of you that can relate, I feel for you. But we've had very little activity outside our own homes. We have encouraged our employees to only get groceries and medical attention, and encouraged our employees to follow social, we call it physical distancing, because we still need to be social. We need to interact with each other. For mental health issues and things like that, we need each other. So so there's been very little activity outside the home, but we try to connect using technology. Most of our employees are telecommuting. We follow strict physical distancing. Some of our essential employees that have to be public facing, we've asked to wear N95 masks, not all of them, because really we have not had very many people in our building. We've had intensive cleaning and disinfection of commonly touched surfaces. We've done most of our meetings by Zoom or Teams, and we used to have a lot of lunch meetings. We'd have meetings over lunch and invite people in for lunch. We're not doing that. So we're encouraging to get box lunches delivered if you're going to support the local restaurants, but none of the other, get together and those kinds of things. And as we move forward, the return to prosperity is what we really want to do. And really, we want to make sure we do that safely, because if we don't do it safely, we're going to return to a pandemic nightmare. We don't want that. So we have to have a plan that's actually fluid, and we have to be prepared to pull back on the throttle or push on the throttle. we have tied our plan to the Utah Leads Together plan, but we have to consider other states also because we have employees in other states. So we're looking at those plans as well. We have looked at returning to work, implementing stages or staggering shifts so that people are not all in the building at the same time. What positions can continue to be done remotely is a question that we have. What efficiencies are gained by telecommuting, and what individuals or positions work better in the office? We may not go back to the way it was completely, because maybe there are some things that we've learned in the process and things that we can do better working remotely. And likewise, maybe there are some things that we can do better when we are in the office. We will have physical distancing. It was even brought to my attention that we had a meeting recently, and we had some folks in the office, but they were all zoomed in from their offices. But when they went on a break, they had to all use the restroom at the same time. So when we bring people back into the building, how are we going to monitor that situation? How are we going to look at how we'll keep people all from going into the restroom at the same time? We will likely make the use of masks mandatory, continue our Zoom meetings. We are looking into some different ways to screen temperatures of employees. There's thermoscan units. There's a lot of different technology that has come out, which has been an opportunity for some manufacturers. They've been able to actually come up with these innovative ideas. And we are looking at COVID-19 testing and antibody testing and offering those kinds of things to our employees, and absolutely no symptomatic persons on site, just absolutely none. So when we're looking at this overall plan, we are actually looking at a progression toward normalcy, where right now we're in the urgent phase, and that's the high risk phase also. As we work over time, we want to get into the stabilization phase, and eventually we want to be in the recovery phase, you know, and be back to normal, but the new normal. Some of the challenges that we have, it just depends on your industry, and everyone has a different challenge. I was recently asked about the agricultural industry and how they will implement physical distancing. And you know, there are challenges with trucking, there's challenges with manufacturing, there's challenges in every industry sector. Can you maintain physical distancing through space or through a physical barrier? Floor markings, fencing, those kinds of things. Can you obtain the needed personal protective equipment? That's the other thing. If you have people that need to wear masks and they're not available, and that could be a problem. What innovations or adaptations are necessary? Sometimes I've seen some really innovative things come about. I just read about some local breweries that are switching over their operations to make hand sanitizer. That, you know, those kinds of things are pretty amazing. That I also saw a YouTube video of a doctor showing people how to make face masks out of HEPA filters for vacuums. So it's sparking a lot of creativity in industry as well. Can you pivot and change what you do and still remain profitable? And how will you train your employees in COVID-19 protection and prevention? These are all challenges for every industry. I would like to offer the resources that we've talked about, some of them today. I do want to mention the Rocky Mountain Center has got this great online training that we've pushed out to all of our policyholders to say, you know, take advantage of this. So these are all resources that are available. It's important that we look to trusted sources of information as we go through this, so that we're all on the same page and actually looking at true scientific data. And with that, I'll turn it back over and stop sharing my screen.
Well, thank you to all of our panelists. You can see how fortunate we are to have them all with us today. That was terrific information. I want to let you all know that we will make their presentations available to you. They'll be available for you on the Chamber's website, and we'll also be pushing them out through the Chamber's social media platforms, so you can look for them there. We've also referenced a couple of times today the Utah Leads Together plan. And I hope everyone has had the opportunity to read the plan. The Utah Leads Together Plan 2.0 has just a great amount of information for anyone who is putting together a reopening plan for their business, or if your business has not been closed and you're still operating. It is chock full of terrific information that will help you understand how to operate during these, what I will call very trying times. At least they're trying for me. And so I would encourage everyone to review this plan carefully. And it is, I think it's 27 or 28 pages. And if you feel like you don't have time to read all 28 pages, which I think the governor would say you can make the time, but if you feel like you want to skip ahead, I would encourage you to look at the appendix in the back, because that's really where all the detailed information is, where all the best practices are. And I can tell you that at City Creek Center, our objective is to be a model for operating according to the Utah Leads Together plan. And so that's really what the goal that we have set for ourselves. So I told you that we would have the opportunity for some questions, and if you've seen me looking down, it's because there are some people behind the scenes who are texting me your questions. And I know that we've had a question from a lot of people about timelines for the state and when businesses will be allowed to reopen. And I know that's a very hot topic. And I think what we have to do right now is really look to the governor for that direction. I think it's been clear in the Utah Leads Together plan that the governor has been sort of pointing us like a beacon to that May 1st date. And I know that's what we're looking, towards right now at City Creek Center. I'm sure many of your businesses are. I think right now that's still, according to what the governor has said, that's still sort of a tentative date. There's still many indicators that, we're watching and we're still sort of seeing where we're going to land. But tentatively, I think we're all sort of still looking towards May 1st. And we can continue to stay tuned for more updates on that, as hard as it is. I mean, I know all of us want some sort of concrete, information. We like to be able to move forward with certainty. But as Dr. Hegmann says, in a pandemic, we have to be prepared for change every day. And that's certainly what it has felt like throughout this entire time. Things are changing all the time. So, all right, well, we've got some other great questions from our audience as well. So someone asked a question about what returning to our new normal means. Does that mean that we can stop social distancing and all of our prevention practices when we return to our new normal? So, Hannah, what would you say about that?
Well, we need to be careful in going back to the new normal. And when I say back to the new normal, I don't think it's ever going to be exactly the same as it was, but it would be a phased process. You wouldn't just, okay, tomorrow we're done physical distancing. I don't think it would be that simple and that quickly done. You still have to maintain the physical distancing as we progress through the different phases of the disease cycle.
This is Kurt. I agree with Kathryn. The one thing I would note is I'm optimistically thinking we really are going to get back to our normal eventually, but the new normal will be an intermediate step. And I do agree with that we will have to, for a period of time at least, to guard against and minimize a second wave and, God forbid, a third wave. We need to keep cognizant of all these lessons that we've learned over the last 2 months.
And maybe I need to clarify, the new normal for me is back to normal, but wiser.
There we go.
Matt, would you add anything?
No, I think these guys have covered it pretty well.
Yeah, that's great. So I would add that, I've spent a lot of time in the last couple of days adding an abundance of signage at City Creek to remind people about physical distancing, about good hygiene practices. And, we're hopeful that, as a big public place that we can sort of help to remind and educate the public about all of these practices. Which is maybe something that we wouldn't, feel like we had to do normally, but we feel like, maybe when people are out in public, they'll get a little relaxed and forget. What ideas do you have about how to educate our employees when they're in the workplace about all of these practices? Do you have suggestions about that?
We've been starting to work on that in the Rocky Mountain Center. In fact, just this week, I've been working with Tony Chambers, who runs the place. It's a misnomer that I run it. I really don't. But Tony's gone around and she's taken tape and put 6-foot distances on the floor to already start that process, so that even though we have not actually reconstituted our workplace yet, yes, there's a few folks around the building, like Katherine said, at WCF Insurance. What we're doing is already doing those preparatory steps with the 6-foot distances, trying to, for example, somebody's cubicle is their space. We don't want people to be entering that, because then that person knows that that's their secure safe zone, if you will. So there's things like that that we're already implementing and trying to learn. And I think this is also part of the subject matter for next week's webinar.
Great.
Yeah, I just wanted to add that it is still a dynamic situation and very industry specific. So there's not a one size fits all solution, and what's working or we're doing at the Rocky Mountain Center won't work at some other places. So I think really considering your own company specific situation, and then looking through the bigger lens of the fact that what you say and what you do right now may be very different in a week or in a couple of weeks. And so working with employees to say, look, we're all in this together and it's still a very dynamic situation. And so here's what I know going forward, and here's how we all can work together to do that. And we may have to adapt again tomorrow or next week or next month.
So Matt, sort of following along that line, someone asked a question about how would you help employees who say they are fearful about returning to work? How would you reassure them?
So that's a really good question. I am a big proponent of information. And so I would share what we know so far in terms of the disease. Most people who have the disease have mild or moderate symptoms, and most people recover without too much of a problem. If you have, comorbid conditions, high blood pressure, diabetes, if you're an older individual, some of these other factors, you're at an increased risk, but that doesn't mean necessarily that if you get it, you are going to have problems. So I think the first step would be just educating and helping everyone make sure that they know sort of what the risks are to them. Second is that social support, and Katherine mentioned it too, the physical distancing versus the social distancing. I get along really well with all of my coworkers, and I miss seeing them. Seeing them in this type of an environment it helps, but it's not the same as getting together, even if you're still 6 feet or 10 feet apart, and being able to talk about what you did over the weekend or what challenges you're having with, homeschooling the kids or getting groceries or any of that type of stuff. So I would promote those types of social contacts too. And make the work environment, whatever that is for your industry, something that people want to engage in and help build that community back up. So those would be my first two approaches.
Can I say something? One of the things that we have done is we've started a weekly Zoom meeting with all of our employees, and just here's where we're at, here's what we're thinking. And we started early on. Ray Pickup and Matt Lyon started with emails. and different things like that to help communicate with the employees. And so the education process was all along. So here's what we know, here's what we're going to do, here's what we intend to do. And all the way through the process when we realized how serious it was becoming. And I think that keeping touch with the employees is really critical. To know what they're feeling is important too.
That's great, Katherine. I think also, the deck that you presented today is a wonderful model to help people sort of build their reopening plan. And I think gives us all a little bit of hope as to, how we can start up and presents a little bit of a safety net there for people to look forward to. So I think that's very helpful as well. Kurt, would you add anything about how to tamp down fear in the employee group?
I think those were great answers. Totally agree that information is critical. I also encourage people to share in decision making. After all, nobody's got a monopoly on knowledge here. And so there's no doubt that some of our employees are going to come along with the best idea. And that's just great. If you have that atmosphere, you know what I'm talking about. They know that problem solving is a fun task. It's something we all work on, and you end up with some of the best solutions if you just simply listen, so those are some of the things that I also would encourage. And going forward, again, projecting to next week where we'll dive in a little bit further depth on this. There's so many tools out there to use. So we will also try to help with collating a few of those more valuable tools.
Yeah, that's terrific. I just want to encourage all of our participants, if you have a question, please use the Q&A feature on Zoom. It's at the bottom. If you just sort of hover over there, for anyone who doesn't know how to use it, just submit your question using the Q&A feature and we'll be happy to answer that for you. We're getting some really great questions, so we're going to try to get to all of those for you today. The next question we have, I think is really an interesting one. We have had several people ask this, and it's about employee break rooms. So what recommendations would you have for managing employee break rooms or shared spaces, which typically have shared equipment and supplies? And I know I personally have a few of those with, I have about 300 employees, and we've spent a lot of time trying to think through best practices for those, but I would love to hear you talk about what you think we can do with those.
Well, I'll go first. A couple things. I think we should assume that those areas need to have cleanliness standards. We need to address appropriate disinfectant use after each use of the area. So I think if you combine both the care of disinfection plus social distancing, I think that those are the two main things. There also are some examples where people have put plexiglass dividers and those sorts of things, especially in tighter areas where it may not be quite as easy to do distancing. So there's another element. Another element could be, and we haven't really gotten into this too far nationally, but the issue of ventilation. Ventilation, we're familiar with that in an industrial setting where we have things like local exhaust ventilation and things like that. But certainly there are ways in which the direction and currents of air can be used to our advantage in a situation like this.
One of the things that we are considering is phasing those back in too. We're not going to come right back to work and have those open to everyone. They will likely only be opened back up toward when we get closer to the yellow and the green in the hazard section. So all of those things are possible too.
One other thing that I would bring up is encourage workers to bring in things from home. So like the coffee pot, instead of having the coffee pot there, have everyone just bring in a thermos of coffee or whatever their beverage of choice is, right? And then also think about, are there other locations where you can have more social distancing, or increased ventilation or some of these things where you can still have that break room type of an environment. I know that for me, I'm loving this nice warm weather that we're starting to have. And so I'm spending a lot more time outside. And so that may be another opportunity too, is to set up some type of a break room environment outside where people can still social distance and that type of stuff. But still, you know, it's sort of that shared space type of an environment.
Well, as someone who has a retractable roof, I'm really happy to hear you all talking about ventilation, because we think that's one of the best things we have going for us. We're getting a lot of questions about if you have any opinions on the best types of thermometers or thermal scanners, and how should those be acquired, or how should we put in a good regime for using those in the workplace? Any thoughts about that?
I will jump in and say that I have not, this isn't my particular area of expertise, so I'll leave it to the other panel members to correct any errors that I say. But I think that type of objective thermal sensing, no matter how it's done, should also be used in conjunction with other symptoms, right? So you want to, and it promotes that communication. So checking someone's temperature is one thing, but then also asking them, how are you feeling? You know, do you have a cough? Do you have some of these other common symptoms that are common for COVID-19? To help identify those individuals, and then you can implement different things from there. So I personally don't have any specific recommendations for a thermal sensor. I know that there's a lot of them out there, but I think it's definitely a tool that can be used, but you can also use it in conjunction with other things.
Good.
We're currently looking at different thermal scans and type things so that it's a hands-off, because if you have someone there that's actually taking temperatures and they have to wear personal protective equipment, you get into all sorts of other things. So as much as you can do it as a hands-off, however, some of those are pretty expensive. There are some that are not as expensive. So we're evaluating that right now, and I might be able to provide more information next week on where we're at on that. So.
Thank you.
The other thing I would add is they're becoming harder to find. So this is one of those areas, again, as soon as, true of this entire epidemic, right? As soon as somebody identifies the technology, suddenly it's in short supply, or medication, or fill in the blank. But let me also double down on the other two folks commenting that I think it is not just temperatures. You really want to look at both temperature plus symptoms. And in this day and age, there is the ability to screen symptoms on a daily basis very quickly using electronic means. So this is not a significantly difficult thing. And even in a small business, one wouldn't necessarily have to go to a computer-based system either. You could always just do it more manual and so forth. But there are options. It's not tough.
Great information. Thank you for that. We have another question here about recommendations for cleaning in large venues, such as stadiums or amusement parks and event venues. Any specific recommendations that you would have about cleaning? I know I've been thinking a lot about cleaning in a large venue recently. Any thoughts you have there?
Kathryn, I don't know if you wanted to cover that. I've got one comment to make is if somebody's talking about an infrequently used venue, then you have consideration for what's the longevity of the virus on that surface. So there are some data to guide that. So, when you're talking about stadiums, it's possible that there's not that much that needs to be done. Whereas when you're talking about turning over things on a daily basis, that's a different story.
I agree with that. It depends on how often you're having a turnover and how often you're bringing it. And it's the same in a workplace too. How often are you bringing a different work crew in? Because they'll have different exposures. So you have to clean in between. And it could be as much as, you know, spraying everything down or wiping things down with the disinfecting wipes, which are also in short supply, by the way. And these are all challenges that employers have because these things are in short supply. But if you look closely, you can find people, you can find vendors that you can get them through. But they are in short supply.
Okay, let's see. We have a question here about if businesses have employees that are coming into work physically, what are the recommendations for wearing masks? Should this be mandatory?
I guess in terms of sequencing, I'll take a first stab at it, and then everyone else will correct me. Clearly, we've gone in this epidemic, from a position originally, if people remember, of only worry about hand washing, to then it became a concern about droplet spread, and then it became, which only goes about 6 feet, and then there's some concerns about aerosol, which stays suspended for a longer period of time and travels further. So if you think about that and how that has changed, that begets the issue that we really need to consider, certainly in, I think, the red phase and probably the orange phase, having masks. What we do beyond that, I think we have to determine, but initially I am in favor of that, barring that there's something else, like, you know, what the ventilation is, and this office isn't going to, you know, have air going out and you don't have to worry about it contaminating the workplace or what have you. So those are a few thoughts on that.
I would recommend having, at least during the red phase and orange phase, having your employees when they're together, when you bring employees back, and they're in, even if they're within, you know, outside of 6 feet from each other, it can spread through the air, and I would recommend having masks.
Okay, that's great. Got a question here about businesses are wondering if their business is essential or some other classification, and who is making the decision about this, and when guidelines for this will be announced. I think the answer to this is probably going to be in the governor's plan that will be announced as we get closer to the May 1st date. Is that the information you all are hearing?
Yes.
Yes.
Yeah, I think the Utah Leads Together plan is going to have information about how your business is classified and what is appropriate for you as we're marching up towards that May 1st date. And again, you know, I think we all have to remember that that May 1st date is still tentative based on, you know, the results that we're seeing in our state. And it's so hard, I think, for all of us in this, you know, time when, you know, every day is a year or longer, as Curtis taught us, and everything is changing so rapidly. But, you know, we just literally have to stay tuned to what's happening every day and sort of see where we are. And, you know, I know in my own organization, we're in, you know, sort of a 24-hour cycle. We're seeing what happens today and making decisions for today and hoping that that will allow us to plan out until tomorrow. But it is very hard for, you know, large business organizations to accept that and incorporate that into their strategies. We've had a few people ask questions, Katherine, about the color-coded template that we had in your deck, and talking about sort of that model for, you know, we're in the urgent phase now and hoping to move into the stabilization phase. Could you maybe talk a little bit more about that and what the color codes mean, just to help everyone get on board with that a little more?
Well, the color code means So what I had done in that graphic is interposed the phases, the 3 phases with the 4 different risk levels. The red level is high risk. The orange level is medium to high risk, and then yellow is less risk, and then green is return to normal. So that's the lowest risk level. And so with each phase and level of risk, we want to look at different things and how we reopen our businesses.
Well, I think it's very exciting that, you know, there's the potential for us to be sort of moving forward, and you know, that has sort of given me hope in the last, you know, our last 24 to 48 hour cycle. I felt, you know, certainly more hopeful, and certainly felt that way, you know, looking at what you've prepared today. I think just having that sort of zeal for planning has helped me to feel better too. So I think that's, you know, that's all very exciting. And I also think that there's the possibility that as we move forward, we may see, you know, certain businesses who could be in certain, you know, phases. I wouldn't want to speak for, you know, the governor or the governor's office, but, you know, some of us may move, you know, through this a little more quickly than others, you know, as well, depending on if we're deemed essential or not essential, or however, you know, that may come to pass. So let's see, I'm just trying to make sure that we have covered all of our really great questions here. Let's see, I've got a couple of questions about employees who, even if we are sort of into the stabilization phase, saying that they may want to choose to stay at home even if we have reopened. Do you have any comments about that? Do you think that goes back to that sort of positive communication that we were talking about?
I would say so. We have, especially individuals who have significant numbers of comorbidities, and let's say they're able to work well from home. I think those are great candidates to do that and to continue to do that. So we may think about this a little bit of a sliding scale, if you will, that we bring back earlier the youngest, healthiest, and, you know, do things that a year ago would be viewed as taboo to even discuss. But the reality is, in an epidemic, we need to do that. And that protects everybody. And it may be that we have to blend it, and the person needs to come back periodically for a meeting, and maybe we put them in a mask, you know, everybody's in a mask, but maybe we put them in a better situation of a more protective type of mask and so forth. So I think there's a number of things we can do there to really help and mitigate the risks.
Yeah, I think that's so well said. You know, I think flexibility with our employees is going to be so key. I know I have a team member who has 3 children under the age of 5, and you know, her daycare is closed, her schools are closed, and you know, she's all excited about the opportunity to, you know, possibly come back to work, but there's no way she can come back to the office full time. And so, you know, being able to allow her to, you know, continue working from home is key for all of us, you know, right now, frankly. And so I think just thinking through every employee's individual situation is going to be something that we're all going to need to do, you know, especially with schools and daycares being closed. So I think one of the things that we wanted to do is, I think our panelists had an assignment for everyone here with us today. So would you all like to make your assignment for everyone who's with us today?
Kathryn, would you like to go?
Sure. I would encourage folks to look at the PowerPoint, download the PowerPoint from the website, and look at the questions and give those questions, you know, some thought. How do they apply to your business? And then maybe next time we can talk about, you know, further how you can actually answer those questions in a good program.
Well, that sounds like a great assignment. I don't think everybody knew that they were going to be coming away with homework, but maybe everybody who's working from home has a little time on their hands right now. So certainly they can do that. Just a few reminders about resources. So the Utah Leads Together 2.0 plan is available at coronavirus.utah.gov/business. We encourage you to download that. And all the presentations that you've seen today are on the Chamber's website, and they'll be pushed out through social media. And we certainly want to thank you all for joining us today. This has been a great panel discussion. We want to thank all of our presenters, and most of all, we want to thank you all for giving us some hope. I think it's just exciting to be talking about moving forward from where we are at this time. So definitely we're feeling hopeful. We just need to maybe adjust a little bit, things we've all done, and be able to execute a little bit differently, and we can stay safe and stay healthy, and hopefully move forward and lead together in our new environment. We hope that you will all join us for implementing a safe and healthy work environment plan part 2, which is going to be on April 29th at 2 p.m. So thank you all again, and we'll hope to see you on the 29th.
Thank you.
Thank you.
Thank you.